The core services plan is one that we have on an annual basis, and it is through our child welfare department. They run it's mostly for preventive. We don't have services that are through our core allocation that we use for folks who are in custody. But we do things like home-based intervention. So this is where we have what used to be CVR Youth Connect and is now Paragon. We have sex abuse treatment. We have life skills, which pays for Laura Lee, who is our case aide and coach. We have some aftercare services, and then we also do some mental health and substance use. And so I would just request permission to sign this, and to also for me, and also have Rob sign it. And we have two allocations in the core. One of them is 100% paid for by the state. The other one is an 80-20 that we are typically used to. And we have, it's just under $330,000 for the total.
Questions?
Nope, no questions.
Okay, so I will make a motion to approve Donna's and Rob's signature on the core service plan for fiscal year 24-25.
And I will second it. Been moved and seconded that we approve Rob and Donna's signature on the core services plan for 24-25. All in favor?
Aye.
Aye. All opposed? Motion carries. Community Advisory Committee.
Yeah, so hopefully you have a flyer in your packet for the Community Advisory Committee. We are actively recruiting for 5 members of our community, and they can be from Otero, from Bent, or from Crowley County. And it's for our case management agency. That's what CMA is. So we have quarterly meetings of our Community Advisory Committee, and what we need for them to do is to be eligible or recipients of our case management agency programs, which could be any home and community-based service program. And then if we are not able to get members, we would like to have family members. But really what the healthcare policy financing would like for us to have is folks who are actually receiving the services to then give us feedback on what is going well, what is not going well, what kind of complaints or suggestions for improvement we receive, how to help resolve those, and really just folks who are able to speak from lived experience and give us some guidance. So I just want to put that out there that we are really actively recruiting for those. We will meet quarterly. We can help provide transportation to the meetings, or we will also have them available via Zoom or whatever kind of platform works the best for the folks. We only, the healthcare policy financing would like for us to have 5. So I feel like that with 5 people and then with the staff from our agency, we should be able to be pretty nimble. The meetings do not have to happen in Otero County. They certainly don't have to happen in La Junta. So if we can move them around, we can have them available for folks throughout the region. So we really would like also feedback on that too, like how is the best way to receive feedback for our programs. So I just wanted to put that out there in the universe. So Betty, and if there are other press folks there that could pass that along, we would love to have some interest, even for questions. I think there's a way to apply, and then Ann Russell's information is there for questions. I'm available for questions, so just like to put that out there.
Thank you. That was my question, is that the only way to apply is through the click and through Ann's email?
Absolutely not. However, that would be online. But if we have folks who want to, just give us a call, we can send out an application. It really is a very simple application too. It's the name, what county you live in, and how you might be associated. So if you're a member with lived experience, if you're a family member, or if you're a professional. Again, we would really, our top priority is to get members who are eligible. If that is not possible to fill up all 5, seats, then we would love to have family. And at the very last is those of us that are professionals. Because while we might think that we speak the language of the folks that we have worked hard to serve, we do not. And so we really want to have folks who have that lived experience.
One more for me. Ready?
Yep.
So you said 5, is 5 the minimum, or is that just what you need is 5? If 13 people apply, you'll take 13 people, but 5 is the number you're looking for.
5 is the number that healthcare policy financing said that we should have, based on some algorithm or whatever. The requirement is to have at least half, the majority of the folks need to be members that have lived experience and are eligible for the services. That being said, even if folks who are not, if we have 5 voting members and we have 25 others who want to come and hear the discussion and weigh in on, to much like this board or the city boards or whatever, ours would be advisory, so it's not a governing board, but we would love to have as many voices in the room as we can get. Just the voting members and the ones who really are actually making the official recommendations to the department need to be, at least half of that board needs to be folks with lived experience.
So 3 out of the 5.
3 out of the 5. 4 out of the 5 would be fantastic. 5 out of the 5 would be what we would want.
Okay.
Yep.
Those are my questions.
Right.
My only question is I don't wanna be a voting member, but I'd like to be involved. So keep me up on it. I would love to come to the meetings.
Absolutely. Okay. We will do so, Rob. Thank you.
Okay, anything else?
Not for me.
Okay, nothing else. We are adjourned.
Thanks, Donna.
Thanks, Donna.
Lynn, would you do me a huge favor and send me a list of all the folks that attended, if you don't mind?
Absolutely, I can do that for you.
I appreciate you. Thank you so much. You guys have a great day.
See ya.
Bye.